To insert a cochlear implant is a complex and challenging surgery. The surgeon needs very specific knowledge and high concentration. This has two reasons. One is the very limited space in which you have many important structures in a very small area, like the facial nerve, ossicles and the equilibrium organ. The second reason is the very expensive implant that should not be damaged during the surgery. Head surgeons need to practice those difficult interventions under the guidance of experienced surgeons like Professor Rudolf Probst regularly. On a global scale, this is difficult to do in many hospitals, and it is a big effort. To train this kind of surgery on human specimens gets harder and harder. On one hand, the availability of human specimens in some countries does not exist because of ethnical reasons. On the other hand, you have hygiene regulations because these human specimens are preserved in a special way. With our unique training systems, we have the goal to change the methods of education and further education of surgeons fundamentally. Because Phacon systems provide the surgeons the possibility to train and simulate under real conditions, for example, the surgery of paranasal sinuses or at the temporal bone. Therefore, we are using new technologies such as 3D printing. We refine this process for our purposes so that we are able to rebuild even the smallest anatomical details like nerves and vessels true to scale. With a new developed hardening procedure, we have also succeeded to exactly copy the properties of human bone in our models for an even more realistic simulation. During the development, we place great value on a realistic surgical experience. You should have the feeling you are in a real OR. We also get help from experienced and renowned surgeons. We use their experience for the ongoing development of our products to make them more tactile. For instance, with our artificial soft tissues like the dura or mucosa. With those developments, the training of surgical interventions on our models becomes more realistic. Phacon's training models are excellent. On the one hand, they really provide the feel of bone during the drilling, or on the other hand, there are polyps inside the sinus model which look very natural, making the training feel like you are performing a real surgery. To provide the learning effect and training not just haptically but also to support it efficiently, our models are combined with a navigation system. Therewith, the surgeon can orientate himself during the surgery within the CT images and the three-dimensional virtual model of our artificial patient. The big advantage of our navigation system is that you can record live the way and scope of injuries within the surgical area. And afterwards, you have an evaluation of what happened during the surgery. In 2007, we started as a young startup company with the development of a training system for the temporal bone surgery. Since then, we constantly research on new innovative products. Our spectrum covers many different training possibilities. The spectrum ranges from head surgery, spine surgery, and the newest development, a training arm which is used for the training of inserting cannulas, for example, for dialysis patients. Renowned clinics, surgeons, and large manufacturers of medical equipment work with our innovative training system on a worldwide basis. Over the years, we use the Phacon models regularly. On the one hand in courses, and on the other in advanced trainings. All our assistants train with the Phacon models. They can be reordered easily, they are cost-efficient and always available. Real training, virtually assisted. With our training systems, physicians are able to train complex surgical techniques efficiently and for a reasonable price. Phacon, 3D life modeling and simulation.